Diabetes is a disease that affects a growing number of the UK population. As someone with diabetes, you should check your feet every day for any blisters, breaks in the skin, or signs of infection such as swelling, heat, or redness. You should wash your feet every day with warm water and mild soap. Rinse them thoroughly and dry them carefully, especially between the toes. Do not soak your feet, as this can damage your skin. If your skin is dry, apply a moisturizing cream every day, avoiding the areas between your toes. Cut or file toenails regularly, following the curve of the end of your toe. Use a nail file to make sure that there are no sharp edges, which could press into the next toe. You should change your socks, stockings or tights every day and check inside the bottom of shoes before putting them on to make sure that nothing sharp has pierced the outer sole or fallen in. Everyone with diabetes should expect a foot risk screening every year. This is performed to identify any sign of problems with your feet, including risk of developing foot ulcers. You should be told which of the 4 risk categories you've been assigned. Low risk. Low risk shows that you do not have nerve or blood vessel damage at present, and so you are currently at low risk of developing complications due to your diabetes. You should continue to check your feet daily, look after your feet as normal, and have them screened each year. Moderate risk. If your feet are at moderate risk of developing ulcers, you will need to take extra care of them. You may need treatment by a podiatrist or podiatry technician. This will be discussed with you and a treatment plan implemented according to your needs. You should continue to check your feet daily and contact your podiatrist immediately if you discover any problems. High risk. If your feet are at high risk of developing ulcers, you will need regular treatment by a podiatrist. If you have had an ulcer before or an amputation, you are at high risk of developing more ulcers. If you check your feet daily and look after them carefully, with the help of a podiatrist, you will reduce the risk of more problems. Diabetic foot ulcer. If you have a diabetic foot ulcer, this means an area of skin has broken down and the tissue under it is now exposed. In some cases, the skin does not heal very well and is likely to develop an ulcer or infection after only a minor injury. You will need regular podiatry treatment, and your podiatrist will draw up a treatment plan for you to meet your needs. Do not touch your dressing unless you've been advised to by your podiatrist and have been properly shown how to remove and replace it, and you have suitable dressings to replace the one you are changing. Continue to check your feet every day for any other problems that may have arisen and discuss these with your podiatrist.